Rapid advancements in medicine and technology mean that most diseases are treatable nowadays. But what happens when people come into contact with the most dangerous bacteria for the human body and have to fight them off? Let's delve into 5 of the most dangerous bacteria ever uncovered. Number 5, tetanus. Tetanus is also known as lockjaw and is one of the most deadly bacteria in the world. Once you've contracted it, your muscles start spasming, starting from your jaw and then spreading like wildfire throughout your whole body. Some of these spasms are so strong they could probably break your bones. But the problem is that tetanus doesn't just stop at muscle spasms. It brings a whole list of terrible symptoms like fever, headaches, trouble swallowing, high blood pressure, sweating, and an increased heart rate. Symptoms usually begin about 3 to 21 days after the germ decides to crash your party, and getting back to your normal self can take months. Sadly, about 10% of cases end in death. Now, if you're looking to steer clear of tetanus, it's all about avoiding places where it likes to hang out. This means that spots that have a lot of soil, saliva, dust, and manure, basically the germ's version of a VIP lounge. It usually sneaks into your body through a cut or wound caused by something dirty. And once it's in, it starts by making toxins that mess with your muscles. Here's the interesting part though, you can completely get rid of tetanus. If you cut yourself on something you suspect could have bacteria and haven't had enough doses of the vaccine, your doctor can give you both the vaccine and some special antibodies to help you fight it off. They'll clean up the wound, toss out any dead tissue, and if those muscle spasms are really acting up, you might need some muscle relaxants or a ventilator to help you catch your breath. But even with all that treatment, tetanus is very hard to cure fully. So while rusty nails might seem like the only source of the bacteria, it's not actually the rust that's the issue. It's the dirt and germs that are the real problem. Number 4, syphilis. If you need a reminder of why safe intercourse is always the way to go, then just wait till you hear about syphilis. This disease is caused by a bacteria called Treponema pallidum, and it wreaks havoc in 4 stages. First, it begins as a painless sore known as a chancre, usually appearing around 1 to 2 centimeters in size. Then we've got stage 2, where a rash might decide to pop up on your skin, especially on your palms and the soles of your feet. After that, the bacteria needs time for a breather and enters the latent stage. You would experience no symptoms, but that doesn't mean the infection's taken off for good. Nope, it's just hiding in your body, playing the waiting game until it's time to spring into action. And then out of the blue, stage 3 waltzes in unannounced, maybe even years later, bringing along its soft, non-cancerous growths or nerve and heart issues. Now let's talk transmission and what's cooking up with this whole mess. Syphilis is all about spreading through sexual contact and can even hitch a ride from a mom to her baby during pregnancy or birth, leading to congenital syphilis. And yeah, there are a few other diseases caused by similar bacteria, but they usually don't come knocking through the bedroom door. So how do doctors figure out if you've got this sneaky bug? Well, they've got a couple of tricks up their sleeves. Blood tests or checking out blood samples under a microscope. And when it comes to preventing it, it's all about wrapping it up. Using condoms during intercourse can really help keep the risk in check. Now, let's say you do end up with syphilis. Don't worry about it, because there's a light at the end of the tunnel. It can be treated with antibiotics, usually with a healthy dose of penicillin. But just a heads up, it might come with some awful side effects like fever, headache, and muscle pains. Number 3, Staphylococcus. Staphylococcus can be observed through a microscope and are seen as little round globes that love to huddle up like grapes under a microscope. Now, these bacteria are a real headache, especially in hospitals where infections are a big deal. Some types have gotten super stubborn and won't budge even with antibiotics thrown their way. Hospitals try their best to kick them out, but they just keep hanging around, especially in places where folks are already on the vulnerable side. There's a whole bunch of Staphylococcus species, more than 44 of them actually. Most are harmless and just chill out on our skin and in our noses without causing any fuss. But here's the thing, anyone can end up with a staph infection, although some people are more likely to get it, like those dealing with chronic conditions such as diabetes or cancer. And in hospitals where patients' immune systems might not be up to par, the risk of a serious staph infection skyrockets. One of the nastiest forms of this bug is Staphylococcus aureus. It brings on some serious symptoms like sepsis, a real troublemaker. From sticking to tissues to messing with our immune system and causing chaos in our blood vessels, it can really cause some damage. If left untreated, it can even lead to a serious health scare like septic shock. Now get this, Staphylococcus can even mess up your dinner plans by causing food poisoning. These little critters can whip up toxins that'll have you feeling mighty sick if they decide to crash your improperly stored food party. Number 2, Streptococcus. Streptococcus is present in pairs or chains like a close-knit community and comes from a family of bacteria that's more diverse than you might think. Scientists have discovered over 50 types of strep, and while some are harmless, other forms can wreak havoc. They're the ones behind infamous infections like strep throat, pink eye, and those scary flesh-eating episodes. Now, when it comes to dealing with the bad apples, antibiotics are our go-to warriors. Penicillin and amoxicillin are like the heavy artillery, blasting away at the bacteria's defenses so our immune system can swoop in for the win. Treatment usually lasts about 10 days, giving those meds enough time to clear out the invaders. But what if you're allergic to penicillin? Don't worry, there are backup plans. Enter clindamycin, another antibiotic that throws a wrench in the bacteria's growth plans by blocking their protein production. So whether strep's causing chaos or just hanging out harmlessly, it's a reminder of the microscopic world that's all around us, sometimes causing trouble, sometimes lending a helping hand, but always fascinating in its complexity. Number 1, tuberculosis. Tuberculosis is a big deal in the world of infectious diseases. It is mainly caused by this sneaky bacteria called Mycobacterium tuberculosis. It's like the mastermind behind this whole operation. Usually, TB targets the lungs, but it's not picky. It can strike other parts of the body too. Now, here's the scary part. A lot of people with TB don't even realize they've got it because they don't show any symptoms. It's like they're carrying this hidden danger known as latent tuberculosis. But if it decides to come out and play, things can take a serious nosedive. Without treatment, it's a serious threat. About half of those affected don't make it out alive. So how does this bug spread its wings? Well, when someone with active TB coughs, sneezes, or even talks, those bacteria hitch a ride in the air and can land on unsuspecting victims. Doctors usually spot active TB with chest x-rays and by peeking at fluids from your body under a microscope. Preventing TB is all about staying one step ahead. It's like a game plan. Screen the people who are most at risk, nab the cases early, and get them vaccinated with something called the Bacillus calumet-guerin vaccine. But let's talk treatment because it's no walk in the park. It's like a marathon of antibiotics taken over a long stretch of time. But the main problem right now is that TB bacteria are getting smarter and are slowly becoming resistant to drugs. Sometimes when TB puts up a real fight, surgery might be the last resort. Surgeons might have to go in and cut out the infected bits of the lungs to dial down the bacteria count. But here's the plot twist. Back in the 80s, we thought we were on the verge of wiping out TB for good. Then boom, drug-resistant strains crashed the party, and it became a global headache all over again. TB can show up anywhere in your body, but it's like a frequent flyer in your lungs. Symptoms can range from fever and chills to night sweats and a serious lack of appetite. If it sets up shop in your lungs, brace yourself for chest pain and coughing up blood and mucus. Sometimes TB throws in some extra damage, like severe bleeding in your lungs or rapidly spreading to other parts of your body. Prevention's the name of the game. Vaccinate early and nab those active cases ASAP. Luckily, there have been some strides in treatment, but TB bacteria have this tough cell wall that makes it hard for drugs to get through. So while we're making progress, there is still plenty of ground to cover. What did you think about these dangerous bacteria, and which one seems the most deadly? Let us know in the comments section below. Don't forget to click the like button and subscribe to our channel.